Testing, mic check. Hey guys, I'm Tay. This is my first time giving a lecture, so bear with any mistakes, stumbles, or mess ups. Today's lesson will be on Chapter 15, Shock and Resuscitation. While we go through this lesson, I want you to keep in mind that guns don't kill, shock does. Alright, just a few things before we get into this. I'll go over a few things that help you guys out. Page 435 is EMS Education Standards, which is a broad, just algorithm of things that you're going to need to know and accomplish and learn to pass this class, to pass National Registry. So look over that stuff. Make your life a whole lot easier, help you retain stuff if you go over your chapter objectives, which are on page 435. And learn these terms. And I'm going to tell you right now, I wish I'd have learned all the terms I could learn when I was in EMT school. Learn to break these words down and understand them. Most medical terms are multiple words put together, and if you understand the individual words, it makes life a whole lot easier on you. Alright, we're going to move right on along. Overview of the lesson topics. Of course, the big one, shock. And like I told you guys before, guns don't kill, shock kills. Remember that. I'll ask you about that later. Resuscitation and cardiac arrest, automated external defibrillation and cardiopulmonary resuscitation, recognizing and treating cardiac arrests, and special considerations for an AED. Introduction. Shock is a state of inadequate perfusion of cells that can lead to death. Basically, you can't feed the cells, you can't leave. The body's attempt to restore homeostasis, which is wanting to maintain a balance, a functional environment for life, results in many signs and symptoms of shock. Resuscitation is emergency care provided to restore vital body functions. Okay, as far as resuscitation, it focuses on managing the airway, oxygenation, ventilation, and circulation. When we talk about resuscitation, most people think of cardiac arrest, but that's not the only thing that resuscitation is involved or associated with. Anybody having respiratory failure, respiratory arrest, anybody that's in shock, and a whole lot of other conditions that can actually be associated with what we call resuscitation. So don't just get focused in on cardiac arrest, because there's a lot of other conditions that we can resuscitate. You guys will learn the ins and outs of resuscitation and recognizing signs and symptoms of shock later on in the lesson. Alright, so let's define inadequate tissue perfusion or hypoperfusion. Basically is inadequate amounts of oxygen and glucose in which the body runs off of that's available to the cells to meet metabolic needs. With that comes a lot of waste buildup in the blood and no way to remove it. So basically, to make a long story short, basically the body can't be fed and it can't remove its waste. So what are some of the waste that our bodies produce? That's right, carbon dioxide. That's one of the main ones. This is caused by a shift from aerobic to anaerobic metabolism, results in decreased energy production and waste product accumulation. Cellular sodium potassium pump fails, leading to cell death. Cell death results in organ failure. And we all know what happens after that, right? So without glucose and oxygen, energy production is severely impaired. Acidic waste products accumulate, and the cellular sodium potassium pump fails, leading to cellular death. When there's a lack of available oxygen, anaerobic metabolism takes place that results in drastically lower production of ATP and the creation of lactic acid as a byproduct. Energy is needed to maintain the function of the cells and the sodium potassium pump. If the pump fails, the sodium is no longer removed from the cell in exchange for potassium. Potassium and lactic acid leave the cell and then begin to collect in the inner fluid and eventually enters the blood. The sodium collects inside of the cell and attracts water. As a result, the cell swells, eventually ruptures and dies. The acid that has been liberated causes a failure of enzyme systems and the release of lysozymes. The lysozymes begin to auto-digest the cell, leading to cell death and eventually organ death. Alright, moving on. Alright, treatment of shock is aimed at restoring perfusion to provide the cells with glucose and oxygen. Restoring perfusion, basically you want to get oxygen and glucose back to those cells to where they can produce larger amounts of energy, which is required to operate organs. Reverse the lactic acid buildup and reestablish the function of the sodium potassium pump. To be effective, restoration of perfusion must be accomplished before critical massive cell death occurs. So once shock goes too far, too many cells die, it's basically impossible to reverse it. Oxygen delivery to the cells is critical and requires breathing, that your breathing is adequate with an adequate amount of oxygen. If you're in a low oxygen environment, there's no point in breathing faster because there's no oxygen in the air you're breathing. Diffusion of oxygen from the alveoli to the pulmonary capillaries, which say fluid buildup in the alveoli will prevent the oxygen from crossing over into the cells. So oxygen transport to the cellular level, release of oxygen at the cellular level. All these things have to be accomplished in order to restore perfusion or to properly perfuse the body, preventing cell death. Okay, so what causes shock? Poor tissue perfusion is caused by one or more problems. Inadequate volume, meaning not enough blood. Inadequate pump function, for whatever reason the heart is not working the way it's supposed to, or inadequate vessel tone. You know, if the jug is too big, then you know you have to have more liquid in the jug to fill it up. You know, so if you start off with a straw and you put a certain amount of liquid in there, that straw fills up. Well, if you heat that straw up and it begins to expand, then the liquid can no longer fill the straw. So think of it that way. Alright, etiologies of shock. Inadequate volume. Decreased blood volume decreases preload. A patient who has decreased blood volume and the preload has been decreased that also affects your stroke volume and your cardiac output. So decrease in cardiac output causes a drop in systolic blood pressure. The systolic blood pressure is responsible for transporting the oxygenated blood throughout the system. So if you don't have enough volume, I mean, the pump can't do its job. A decrease in blood volume can result from a loss of blood, whole blood, from just plasma volume alone. Bleeding causes whole blood loss. Diarrhea, burns, excessive urination, increase in capillary leakage, excessive vomiting, sweating are all things that can cause the volume of the liquid in your body to be decreased to a point to where it affects cardiac output. So you go to a patient that has been sick for 2 weeks, not eating, not drinking, and has vomiting and diarrhea, or say you're diabetics that are urinating a lot because their blood sugar is high. These can all cause a drop in blood volume, which is, if isn't treated, can cause them to go into shock. Okay, so inadequate volume. Patients require an increase in blood volume. If red blood cells have been lost, there is a decrease in oxygen carrying capacity, as well as a decrease in pressure and perfusion. So most times a patient that is hypotensive, we give them a fluid bolus of normal saline. That's great. We can get the pressure up and add volume to the blood, but if they bled out a lot and lost their red blood cells, then they have no way of carrying oxygen around to the cells. So we have to be mindful of that and kind of pay attention when we go to these trauma patients that have lost a lot of blood. All right. Next on our list is inadequate pump function. Of course, we're talking about the heart. The heart is the pump that is responsible for moving blood around the body and perfusing the cells and pushing the red blood cells around to drop off their oxygen and pick up carbon dioxide and all that good stuff and get all the nasty stuff out of our body. So if the heart fails, regardless of the blood volume, we can't deliver oxygen and glucose to the cells. So that's a major problem. This may occur it can be caused from anything from a heart attack to a blockage, pericardial tamponade, which is a fluid buildup around the heart that squeezes the heart. Tension pneumothorax, which also causes tension, squeezing up the heart. It's not able to pump sufficiently to do what it needs to do. With these patients, we need to be careful with giving fluids because it can worsen the condition. All right, now we're getting into the container itself. Inadequate vessel tone. The tone is related to the size of the vessel and the resistance created within it, and is referred to as systemic vascular resistance or peripheral vascular resistance. If the vessel size increases because of a massive vasodilation, the resistance decrease and the blood pressure and perfusion also decrease. In this case, the patient has not lost any blood volume. However, there is no longer enough intravascular blood volume to fill the vascular space. So what is something that can cause vasodilation? Anybody? Anybody want to talk to me? Good job, Mister. Good answer. Anaphylaxis. Somebody has a severe allergic reaction to something can cause major vasodilation. Um, Massive vasodilation can occur from loss of the sympathetic nervous system function or chemicals released within the body. Treatment includes vasoconstriction and volume restoration. Uh, when we're treating shock, it all depends on what's actually causing the shock. Always consider requesting ALS, but weigh the benefit against any potential delay in reaching the hospital. So if you got to wait 15 minutes for ALS to get there, but you're 5 minutes from the hospital, it might be best that you go ahead and haul butt and get there. It is very vital that we recognize shock states. It's important that we provide appropriate emergency care, because what we said in the beginning of the video, guns don't kill. That's right, shock does. Alright, now we'll go into the different categories of shock. There's a pretty good chart, here we go, for the categories of shock. There are 4 major different categories, one being hypovolemic, 2 being distributive, 3 being cardiogenic, 4 being obstructive, and then there is metabolic and respiratory shock, which is kind of a breakdown of one of the 4 majors. So we'll consider metabolic and respiratory as a 5th, but the 4 major ones are again hypovolemic, distributive, cardiogenic, and obstructive, and a small 5th is metabolic and respiratory, and I use the term small loosely. Alright, getting into the different types. Hypovolemic shock is caused by low blood volume. I was telling you guys earlier to learn your definitions of your words, because most of our terms are just smaller words put together. So if you look at hypovolemic, hypo means lower, inadequate, right? Vol refers to volume, and emic pertains to blood. So hypovolemic means low blood, basically. And this can be caused by hemorrhage, from trauma, and can also be caused by burns and dehydration. Alright, hemorrhagic hypovolemic is loss of whole blood, which is mostly caused by some type of a trauma. Non-hemorrhagic hypovolemia is loss of plasma, which can be from fluid loss from burns or dehydration, just sweating a lot. So those are just 2 breakdowns of the same shock. It's just 2 different ways to reach the same ending, but you have to figure out what's causing the problem in order to fix it. Alright, next is distributive shock. It's caused by vasodilation, leading to a relative reduction in intravascular volume. Can also involve fluid loss from increase in capillary permeability. There's usually no actual loss of fluid from the blood, from the vessels, but rather a relative reduction in volume. That is, the volume that has become inadequate to fill the increased size of the capacity of the vessels. So basically, the vessels dilated, so therefore there's not enough blood to fill it in order to pump it through the body. Next is cardiogenic shock, which is caused by the inability of the heart to contract effectively. Generally occurs with loss of 40% or greater of the left ventricle volume. Stroke volume and cardiac output are reduced. A patient have adequate blood volume. The vessels are small enough. However, the pump itself is being restricted in some manner or another, or not necessarily restricted, but it's not functioning properly. It's unable to contract effectively, whether it's by a MI or infarction to where there's cell death. There's a few reasons why the heart doesn't function the way it's supposed to. Damaged heart muscle results in reduced force of contractions, reduced stroke volume, and reduced cardiac output. You can see here there is muscle damage from MI. Once an infarct has happened, those cells are dead. That muscle is dead. Therefore, if it's unable to contract, then you're unable to get the proper action you need to properly pump out blood. All right, obstructive shock. It's when something obstructs the blood flow. Say a large clot that obstructs the blood flow to the lungs, a PE, pulmonary embolism. It prevents actually adequate amount of blood from getting to the left atrium and subsequently the left ventricle. This reduces the preload and decreases the stroke volume, decreases the cardiac output and systolic blood pressure, and therefore decreases the tissue perfusion. Pulmonary embolisms, tension pneumothorax, and pericardial tamponade. The only treatment is to relieve the obstruction, which we can't do in the field for the most part, but it's something that you'll need to recognize. And this is just showing what is happening when one of these three obstructions occur. Alright, metabolic and respiratory shock. Some sources list metabolic and respiratory shock as a fifth category. Dysfunctioning ability of oxygen to diffuse into the blood, be carried by hemoglobin, offload at the cell, or be used effectively by the cell for metabolism. Alright, we're getting into specific types of shock. Hemorrhagic hypovolemic shock, which is a loss of whole blood. We kind of went over that stuff from medical or traumatic causes. Results in decreased perfusion, pressure, and decrease in oxygen carrying capacity. Treat by stopping the bleeding and replacing the blood or blood components. Specific types of shock. Still, we're getting into non-hemorrhagic hypovolemic shock, caused by loss of fluid without loss of red blood cells, which means it's not from trauma or anything like that. It can result from vomiting, diarrhea, and sweating. Administration of IV fluids can be helpful. You still got the same amount of blood cells to carry oxygen. It's just that because of constantly losing volume within the body from other ways such as vomiting and diarrhea, you have a loss of volume. Alright, burn shock. It's a specific form of non-hemorrhagic hypovolemic shock resulting from burn injury. Okay, plasma and plasma proteins leak from damaged capillaries. Loss of fluid and plasma. Oncotic pressure leads to edema. Basically, the body's way of trying to heal itself from a burn is it shifts all these fluids to the burned area, which takes a lot of blood, a lot of volume from the patient. Um, there's specific ways that we go about major burn victims to make sure they have enough fluids in their bodies as to not cause them to go into shock when that fluid shift happens. All right, anaphylactic shock. Chemical substance released in anaphylactic reaction causes massive systemic vasodilation and increases capillary permeability. Epinephrine is the medication of choice for anaphylaxis. Hopefully we all know that. Anaphylaxis is a type of distributive shock because basically the vessels dilate, making the container too big for the amount of volume in the body. Alright, septic shock. Septic shock is another type of distributive shock. Bacteria and toxins in the blood lead to vasodilation and decrease capillary permeability. Patient can benefit from ALS treatment. So there are certain criteria that we use to to say that a patient is possibly septic. Uh, there are several that we won't go too far into detail on, but this is a pretty good chart that kind of goes over the different ways of putting a patient into the sepsis category. So you guys can kind of look over this and keep this chart handy dandy to help you out. Anyway, we can't necessarily treat sepsis in the field because most infections require antibiotics, which we don't carry. But it's nice to be able to call the hospital and give a good report and tell them that your patient meets sepsis protocol. All right, neurogenic shock. Spinal cord injuries can cause a loss in sympathetic nerve fiber functions, responsible for maintaining blood vessel tone. Loss of systemic vascular resistance. Neurogenic shock, also commonly referred to as vasogenic shock, is another type of distributed shock. Spinal cord injury damages the sympathetic nerve fibers that control vessel tone below the level of the injury. Loss of the sympathetic tone causes the vessels to dilate. Cardiogenic shock causes include acute myocardial infarction, congestive heart failure, abnormal cardiac rhythms, and overdose of certain drugs. Patients can benefit from ALS interventions. Like I said, way out, how long it take an ALS truck to get to you. But for registry reasons, say I would consider calling for ALS, or I would call for ALS if you suspect these things. All right, how does the body respond to shock? As we said before, the body has all these natural responses to maintain uh, that perfect level, homeostasis, where it likes to be to function normally. So the body attempts to compensate to return perfusion to normal. Many signs and symptoms of shock are related to this compensatory mechanisms. Sympathetic nervous system stimulation and the release of hormones are the two major uh, compensatory mechanisms. So, anybody remember the general signs and symptoms of shock? All right, so direct nerve stimulation. The effects of sympathetic stimulations are immediate. Increased heart rate, increase in force of ventricular contraction, vasoconstriction, stimulation and release of epinephrine and norepinephrine from the adrenal gland. Try to keep in mind that these things won't happen when it comes to neurogenic spinal shock. Alright, so the hormones the body releases. The effects of hormones are more sustained. Epinephrine has an alpha and a beta effect that causes vasoconstriction and increased cardiac output. Okay, so let's make the vessel smaller and let's turn it up in the heart. We're trying to get this blood out of these cells, trying to get this oxygen and glucose out of these cells. It's the body's reaction trying to restore its normalcy. Norepinephrine has an alpha effect that causes vasoconstriction. Other hormones are also released. There's a pretty good chart. There we go. Showing what epinephrine and norepinephrine do to the body and the signs and symptoms that it causes. So, you know, sometimes when you're doing your assessment and it's asking, you know, how does the patient's skin look and feel? That is an important sign of what's going on inside of the body. So if you got a patient that is pale and has cool skin or diaphoretic, these means something's going on in that body, and kind of gives you a clue to what could possibly going on. You guys can look over this chart as in your book. These are some other hormones that are released, and also the effect on the body, and also the signs and symptoms that are associated with them. All right, we will stop here, and I'll do a part 2.